Is cracking your back harmful? It's a question that comes in the clinic a ton of times. People get very nervous about this cracking sound. And then other people love to crack their back. They feel like it relieves some pressure. They feel it, it does something that makes them feel a little bit better. At this end of this video, we're going to talk about times you maybe don't want to crack and also what most of the research shows. So the debate about cracking and what is actually occurring when you hear a crack is subject to a great deal of debate. There's been studies that have shown it's just a pressure release in a joint. So you have a joint, let's say there's some of these smaller joints called facet joints in your back. When you open up the joint and you actually elongate it, there's a little joint right here which is kind of hard to appreciate. If you go back and forth, it's like a little bag, okay, almost like a capsule that has a certain degree of volume. When you change the amount of distance or the volume of that joint, what happens is there's an audible crack, and they think it's just a gas exchange, it's a pop. And then you can move it around and you notice, wow, I can't crack that anymore, and then it resets after about 20 minutes and you can do it again. And they've shown in some studies and MRIs this cavitation, this gas bubble exchange by a change in position of the joints. And once it stops, that's why you can't repeatedly do it, because it needs to reset and then crack. That's the predominant theory right now. There can be other things that can cause a crack. You can have arthritis in your joint. You can have very loose or hypermobile joints. You can, in theory, have some scar tissue that you're kind of moving past. But ultimately, these structures are so deep, it's very hard to tell what thing might be causing or the origin of the crack or of that audible sound that you feel. But there are common positions that people do to self-crack, and also therapists or chiropractors use to cause a manipulation that will cause a crack. But a lot of people feel relief from this. So what might be a time that we may want to consider maybe to be a little more careful and not do kind of a self-crack or manipulation? One of the things I'll talk about is having a recent fall or trauma. Okay, in young individuals, it's not as much of an issue. In older individuals that might have osteoporosis or osteopenia, which means bone density changes, meaning the bone's a little more fragile, sometimes that rapid movement could, in theory, cause some problems, and potentially a compression fracture or small fracture in the back or wherever you're doing the cracking, whether it be upper or lower back. So we might want to be a little careful of that. If you have any kind of joint swelling or anything that's appreciated, a recent increase, let's say even a fever, maybe you have some type of infection in your back, it's not really related to just a normal crack or mechanical thing, that might be a case where you want to be a little less aggressive about trying to repetitively crack that back. In cases where you have people that are very hypermobile, they call it EDS or Ehlers-Danlos syndrome. Those people's connective tissue was already really loose. So to go ahead and repetitively crack them, the theory is we might be making those joints a little too loose. There's a point where too loose or too mobile or flexible is not good either. And you could potentially make that person more subject to possible dislocations or some kind of not so good, and they're just a little looser in a bad way. Another thing too is you'll find that a lot of the manipulations, whether it be done by a chiropractor, physical therapist, or someone does a self-manipulation or self-stretch or crack, have to do with a lot of what they call flexion, like bending and rotation, whether it be done on the floor, on your side, or whatever else. Those combined motions, if you have a history of a true disc problem, those are people that you probably don't want to put themselves in that position. The disc segment, when you flex and rotate, there's small little fibers in here around the very edges of the disc. When you flex and rotate, called Sharpie fibers, they actually are put in a position that they're the weakest. And if you already have a disruption or some kind of injury to this disc, we might want to be a little careful about doing it for those people that have a history of that kind of problem. Another thing that comes up too is having a history of spinal surgery. Surgery is already delicate enough and can have its own problems in itself. To go in there, especially right after you've had surgery, you really want to avoid that type of stretch, okay, until you're cleared by your doctor and make sure it's safe. Another type of surgery is called a spinal fusion, and let's just go over that real quick. Spinal fusion is when they fuse two segments. So let's say this is, just to give you a little anatomy here, we have L4, L5, and this is the sacrum. It's a triangular bone at the very bottom of the spine here, okay? So when we go ahead and we have a problem, occasionally someone that's got a long-standing back, most times with leg pain too, if they're concerned that this segment, let's say this is the L4, L5, this is the L4 vertebrae, and this is the L5, the disc in between is the L4, L5 disc. Sometimes they feel they have to remove that and fuse these segments by metal fixation. They'll fixate it and stabilize it, but no motion occurs at this segment now. The only problem is that all the motion tries to occur above the joint, or if there's any room below the joint. So those disc segments above and below this area can get hypermobile already without doing this stretch, but repetitively doing this obsessive, some people do this self kind of manipulations and cracks repetitively. That may not be a great idea. Do I know it for sure? Absolutely no. But I would say it's probably not a great idea to do that, okay? So if anything, we want to stabilize and strengthen this area. And I always ask people, I said, did the cracking do anything long-term for you? Did it really solve the problem? That's the thing, is we don't know what we're really getting at and what structures we're affecting. If we're going to stretch something or crack something, I kind of know what exactly is going on. And especially for deep structures in the lumbar spine, we probably want to be a little careful on the side to make sure we're not doing something more harm than good. So if you think you got something from this video, like it, subscribe, and place a comment. Love to hear about it. Have a great day.